Okay, I think we're just waiting for a couple people. Okay, I think we're ready to start. First of all, is it cold enough for everybody? We're gonna have a snowstorm soon, but not today. Good morning, everybody, and thanks for joining us today on this historic day. I'm Bob Garrett, CEO at Hackensack Meridian Health, and it's an absolute pleasure to be here today to really mark an important occasion and a significant milestone as we fight this pandemic. Before we get started, I just want to introduce a couple of our leaders that are with us today. First, Dr. Ihor Sawchuk, who is our Northern Regional President and our Chief Research Officer. Dr. Sawchuk, welcome, and thank you for your leadership. During this pandemic, Hackensack Meridian Health was really on the forefront of innovation, including the development of the first commercial test, which was really a game changer for our clinicians early on in the pandemic. That was followed by a convalescent plasma trial that also proved to be a game changer in fighting this pandemic. And more recently, Dr. Sawchuk has overseen the efforts on the vaccine trials, including the Moderna trial here at Hackensack University Medical Center, and about to start the J&J vaccine trial at Jersey Shore University Medical Center. So welcome, Dr. Sawchuk. I'd also like to welcome Mark Sparta, the president of Hackensack University Medical Center. As I think many of you know, Hackensack Meridian, and in particular Hackensack University Medical Center, was really in the epicenter of this pandemic from the very, very beginning. They've treated more patients here at Hackensack University Medical Center than any other hospital in the state, COVID-19 patients. Mark has done a great job in leading the team here at Hackensack, and truly, during the first surge, really had to make some very critical decisions, which really were instrumental in saving lives and protecting our staff as well. So Mark, welcome. So today truly is a remarkable day. Never before has our nation attempted such a mass vaccination of our citizens. Let's pause a moment and recognize the extraordinary feat that we have accomplished. We have delivered a safe and effective vaccine in record time, about 10 months actually. This is, in my opinion, truly the beginning of the end of this nightmare of the COVID-19 pandemic. It's the good news that the entire world has been waiting for and needs right now. And Hackensack Meridian Health is so honored to be making history as one of the first vaccination sites in the entire nation. First, I want to recognize and thank our healthcare heroes who have battled this pandemic for nearly a year. Their extraordinary skills and compassion were put to the test like never before. And I'm humbled by their courage and by their resilience. When the books are written about this relentless pandemic, they will be remembered as true American heroes. Let's give them a round of applause. Today, 6 of our frontline heroes are being vaccinated, and I want to recognize them at this point. They are, starting to my left over here, Dr. Lisa Tank, who is the Chief Medical Officer at Hackensack University Medical Center. Lisa leads a group of really world-renowned physicians here at Hackensack University Medical Center. And Lisa, we thank you for stepping up and being amongst the first today to be vaccinated. So let's give her a round of applause. Next, we have Reina Barrera, who's Director of Respiratory Services here at Hackensack University Medical Center. She's been here since 2008, and she leads a team of frontline workers who treat COVID patients who are critically ill, and respiratory therapists had really played such a critical role during this entire pandemic. So please welcome Reina. We have with us also, amongst the first to be vaccinated this morning, Dr. Camino Bell, who's an emergency medicine physician who's been at the front lines at Hackensack University Medical Center from the early days of the pandemic. Dr. Bell is also a collegiate football star, and he was also drafted by the Miami Dolphins in 1992 and played football down there. So, Dr. Bell, we thank you for your for everything you do on behalf of patients in the emergency department. Thank you for stepping up today as well. Patricia Gardner is a nurse manager of the cardiac unit. Patricia grew up in Jamaica and moved to the U.S. as an adult. She has been on the front lines since the early days of the pandemic as well. She's inspired 3 family members to become nurses, including a niece who just entered nursing school. Thank you for that, Patricia, and thank you for volunteering today. We have with us also Rafaelina Moran, who has worked in environmental services at Hackensack University Medical Center for the past 10 years. She came to the U.S. from the Dominican Republic at age 9 and is the mother of 2 sons. And thank you for your courage today in coming forward. Welcome, Rafaelina. And last but not least, we have Dr. Greg Sogalski, who's an emergency medicine physician who served in 2 deployments with the U.S. Army in Iraq and Afghanistan. He's the Chief of Quality and Patient Safety in the Emergency Department at Hackensack University Medical Center. Welcome, Greg, and thank you. So these brave individuals are the first of our 26,000 team members who interact with patients who will receive the vaccine over the coming weeks. And we know that overwhelmingly our teams are eager to participate. We are following CDC guidelines to ensure that everyone who wants a vaccine gets one, particularly those first in these most vital jobs. Our network employs a total of 36,000 team members, which is 1/4 of the state's hospital workforce. Once we have vaccinated all of our team members who want to receive this protection, we will begin to vaccinate the public. We will have 30 vaccination sites, including our hospitals and urgent care centers, ready to go. Additionally, we are in the process of developing a mega site location with the New Jersey Department of Health to expedite this process. We're proud to play a leading role in helping New Jersey vaccinate 70% of the population in the next 6 months, a timetable that's been set by the Department of Health and by Governor Murphy. That's never been done before, and we're proud to be a part of that great effort. At this rate, we will have herd immunity in the next several months, and the darkest days of this pandemic will be behind us. I was asked yesterday by a journalist how I felt about the vaccine arriving. And I have to be honest with all of you, I have mixed feelings. I am thrilled that this triumph of science is finally here. But I can't help but think of the harrowing weeks ahead of us. COVID-19 now kills more than 1 American every minute. I can't help but think of the colleagues, neighbors, and loved ones that we have lost, and those who we will lose before the vaccine is widely available. 300,000 Americans have already lost their lives to COVID-19. Please join me in a moment of silence to honor them. Thank you. We must keep our guard up. We cannot give in to COVID fatigue or view the vaccine as a magic bullet. I would like to take this moment to also remind everyone to please get vaccinated. This vaccine is 95% effective. I'll say that again. This vaccine is 95% effective. It's gone through rigorous FDA protocols to become approved. There have been no shortcuts in the review process for safety or for efficacy. It's our best hope to help our communities, our schools, and our economy. Each one of us is important in this vaccination effort. And I want to tell everybody publicly, when it's my turn to take the vaccine, I will do so with no hesitation whatsoever, and I will recommend it to my family, neighbors, and friends. You know, there have been 2 people that have really been instrumental in the vaccine planning process here at Hackensack Meridian Health. They really worked tirelessly to put together a plan that's logistically very, very complex, but have done an absolutely superb job. I just had an opportunity to tour the vaccine site downstairs here at the John Thorough Cancer Center. And really, every detail has really been thought of, and I think it's going to go very smoothly because of all the planning efforts. So I want to take a moment to recognize those 2 individuals. First, Regina Foley, who's a Senior Vice President of Integration and Transformation. Where's Regina? Right over there. There she is. Regina, come on out and get a round of applause. Regina's done an amazing job. And I also want to give kudos to my colleague, Dr. Dan Varga, who's our Chief Physician Executive. Dan has done a great job in planning for these vaccines as well, and has really been our liaison for Hackensack Meridian on the state level in terms of all that planning. So give him a round of applause too. Dan, thank you. And now I'm going to formally introduce Dan. Dan Varga, as I said, is our Chief Physician Executive. He has been at Hackensack Meridian since February, just in time for the arrival of COVID-19. And you know what? I'm so happy that Dan joined the team when he did. He has vast experience and has done just a superb job in dealing with all the complex clinical issues around this pandemic. So please join me in welcoming our Chief Physician Executive, Dr. Dan Varga.
Thank you, Bob, and thanks everyone for being here. It's been an interesting 9 months, I think, for all of us. And I'm really proud to be here with all of my healthcare worker colleagues who are here. You know, it's a very, very important thing that our healthcare workers are the first to go through the vaccination process for two big reasons. The first is these folks have been living in the middle of this war. We always said that one of the greatest risks of the COVID-19 pandemic was the overwhelming of the healthcare system. And this team has seen it. They've bent, never broken. They've rebounded and have had to bend again with this second wave. So getting them protected is the smartest, best act of grace that this country could ever do. The second reason it's really critical is that for folks who've been living this every day, like these folks, to roll up their sleeve and stick out their arm and said, give me this vaccine, is an example to the rest of the country to let everybody know that this is safe. We believe in it. We trust it. We're going to do it. We're going to recommend it to our family, and we're going to make this happen. Bob already kind of alluded to this, but it's always one of my favorite Winston Churchill quotes, which is, this isn't the end. And it may not be the beginning of the end, but it is sure the end of the beginning. So thank you all for being here. And we're going to meet some other frontline heroes. Bob?
Thank you, Dan. And hopefully in 2021, you'll be able to settle into a more normal routine at Hackensack Meridian. Now it's my pleasure to introduce somebody that probably doesn't need any introduction, and that's Harry Carson, who's a true partner with Hackensack Meridian Health. Harry is the CEO of Harry Carson Incorporated, chairman of the Fritz Pollard Alliance, former New York football Giants team captain, and Hall of Famer as well, Pro Football Hall of Famer. Harry, of course, is sporting a nice Super Bowl ring, and he's certainly legendary. And I've had the pleasure to get to know Harry over many years, and he's done so many great things for the communities that Hackensack Meridian serves. And I'm honored to have Harry as our partner at Hackensack Meridian. And I recently, Harry and I co-authored an article that was published in USA Today, and the article talked about inequality in healthcare, and the importance of really getting the word out there, particularly to minority populations, to people of color, that it is important to participate in vaccine trials, that it is really important to get vaccinated as well. So Harry, I thank you for your important leadership there. So ladies and gentlemen, please welcome a true American legend, Harry Carson.
Thank you, Bob. It's a pleasure to be here this morning. You know, there were so many news stories yesterday of, talking about the vaccine and so forth. And Bob stated it before I had the opportunity to talk about it. And that is, while you have so many people passing away, by this morning it was 301,000 people who have passed away as a result as a result of this virus. You're happy on the one hand that there is a vaccine, but you think so much about those who have left us, and you think about the families who are dealing with that void that they're sort of dealing with now. And, you know, I had my own experience, my own little slight bout with the virus early in March. It wasn't so much about me, who was lying on the couch, feeling body aches and so forth. It was my wife that I thought about, because every time she walked by me, I could see the concern that she had in her eyes and where she was really nervous. And I just think to myself, that was a very brief bout with COVID. It only happened and lasted for about 2 or 3 days, but I was able to respond and bounce back. And I think it was a result of just being physically fit, but also, just being in such a position of not necessarily having to go to the hospital or to the doctor, but I sort of went with it. And so I look at what I went through, I look at what so many other people are going through, and I think to myself, I'm very lucky that I only got a slight bout of it. But I think so much about all of those people who didn't get just 1 day or 2 days, but many days of dealing with this virus, especially those who are in the minority communities who are afraid to go to the doctor, go to the hospital, or seek help. I've been one of those people that I've been very conscious about health and maintaining, health and going to the doctor and so forth. I've done many things here within the North Jersey and Bergen County area in regards to prostate cancer awareness. And I think to myself, in those situations, I'm dealing with men, and especially African-American men, who are afraid to go to the doctor. With this COVID-19, this is not just about men, it's about everybody. Everybody needs to understand that there's a possibility that if you don't take the vaccination, you could pass away, you could die, you could catch it and you can die. And you have to do it not necessarily for yourself, but for your family, for your kids and so forth. And so I am happy, I'm proud to put myself out there and be an example, much like the frontline workers. When it's time for me to get vaccinated, I will be first in line, and I will try to lead and set an example for many of those in the African American minority community to beat this virus down. I was part of a team that understood what winning was all about. And, those years that I was with the Giants, we had some good teams, but we also had some teams that weren't necessarily all that great. But I tell you what, the best team that I was on understood that we had to put our differences aside. We had to become a team and be focused on that one key mission, that one key mission, and that is do the best that you can do and be the best that you can be for your teammate and for the team. With this, everybody is on the same team. It doesn't matter where you're from, how much you make, what your religion is, what your political position is. Everybody is on the same team. And I would just strongly encourage, again, especially those in the African American community, those who look like me to not be afraid, but to step forward and do it, if not for yourself, for others in your home, in your community. So with that, I'd like to thank you for having me here and sharing this. I'm not a part of the medical establishment. I'm just an old football player who has some underlying issues. I have some blood clot issues that I have to be very, very careful about. My wife donated a kidney to her brother, so, we have to be careful with her. And I have a mother-in-law who is living with us, and she's got all kinds of stuff going on. She's 77 or 78, but I just think so much about so many people who have these underlying conditions that make them susceptible to the virus. I'm originally from South Carolina, and I know what the folks in South Carolina are going through. So anything that I can do in regards to just getting people or making people more aware of the vaccine, and it's nothing to be afraid of. It is 95% effective. I will do my best to toe my end of the line and be a good teammate with all of you medical professionals, with Hackensack Meridian, and even all of you in the media and everybody at home. I promise to be a solid leader in months and years ahead, and make certain that even with the vaccine, it's not over. We have to continue to maintain social distancing. And for me, I don't do 6 feet, I do 10 feet. Okay? Wear a mask whenever possible. And it's one of those things that it's again, it's not about you, it's about the people around you. And so we're going to do everything that we can do to get back to normal. And that's what I'm shooting for. I got 3 grandchildren. I have a granddaughter who I've only seen one time, and she came in late December of last year. And I desperately want to get back to spending time with my family and also my grandchildren. So I'm doing this for my family, for my grandkids, and thank you, Bob, and thank you, Hackensack Meridian, for the opportunity to be here this morning.
Thank you, Harry, for those very powerful words. And I've had the opportunity to meet Harry's family. You have a beautiful family, and as Harry said, if for those out there, if you're considering not getting vaccinated, don't think just about yourself. Think about your family. Think about your friends. Think about your neighbors, and think about these frontline team members who have been really putting themselves on those front lines at risk each and every day. So, Harry, thank you again for delivering such a great message to everyone. Now I want to introduce Dr. Lisa Tank, and Lisa is one of the 6 that are getting vaccinated this morning, amongst the first in the state of New Jersey and here at Hackensack University Medical Center. And Dr. Tank has really provided great leadership here at Hackensack University Medical Center as their chief medical officer. I've known Lisa for many years, and not only is she a great physician, a great leader, but just a great person. And just one little personal experience when Harry talked about his mother-in-law. When my mother-in-law passed away a few years ago, Lisa went out of her way, traveled about 25 miles to be with the family on that night, and it meant so much to all of us. And that's the kind of caring and compassionate person that Lisa is. So, Lisa, thank you for being who you are. And I want to invite Lisa up before she actually gets vaccinated, and you'll all be able to see it live. She does want to say a few words. So, Lisa Tank, welcome.
So good morning, everyone. So this is a historic moment. I'm grateful to our team members who have continued to provide patient-centric care during COVID. This journey continues for us since March, even before the first patient walked into the doors. The team was prepared, the team was ready, and committed to providing the best care possible to our community. And they have my eternal gratitude for that. I'm humbled and privileged to be representing the HUMC team. But I'm also very cognizant of the lives that have been lost and impacted by COVID. It has touched our hearts, and it has totally changed the world we live in. The vaccine is a triumph over the fight against COVID. I have trust and faith in the science behind it. That is the reason I will be taking the vaccine today. HUMC has treated multiple COVID patients, and I'm proud to say we have discharged more than 2,000 patients to their homes, to their families, and restoring their quality of life. Today is my way of paying it forward to ensure immunity and safety for our community, for my peers, and all the loved ones that you have back home. Please, physically distance, wear your mask, wash those hands, and get vaccinated when it is ready and available. This is my ask, and I think it is an important step that we take towards ensuring that we continue to live healthy lives in the future. Thank you so much.
Lisa, thank you for those beautiful words, and thank you for being willing to be vaccinated in front of this audience today. It's a little chilly out here. I guess they're gonna take your coat off. Okay, Dr. Joe Underwood, who is the chairman of our emergency department at Hackensack University Medical Center, will be vaccinating Dr. Tank at this time.
It is good. There you go, Joe. Sure. Is this good?
Pretend you're in Florida, Lisa.
Yeah. At least it's sunny.
Yes.
All right. Here we go.
Don't actually give it. Okay, are you ready?
All right, Joe.
Ready for this?
Yep, ready. That was good, Joe. Can you feel it?
Not my first rodeo.
I know.
Let's give Lisa a round of applause. Okay, first question. How you feeling? Okay.
And to
Everybody heard
Dr.
that?
Underwood, thank
She's
you.
feeling great. Thank you, Dr. Underwood, for that as well. So thank you, everybody. That concludes our program. We're here to take any of your questions. Any of our experts are here to answer any of your questions at this time. Yes, Brian.
How fast can you get your staff inoculated? What rate per day?
Well, we're hoping, Brian, based on the supply of vaccine that we expect over the next several weeks, to get our staff vaccinated over the course of the next month, and then we'll start to vaccinate, as Dan Varga mentioned. We'll start to vaccinate other others in the community, starting with high-risk individuals, including senior citizens, people with underlying conditions, and then essential workers as defined by the CDC. So we think over the course of about 4 weeks, we should have enough vaccine to vaccinate anybody at HMH who wants to take a vaccine.
Can I ask a follow-up?
Sure.
So the Pfizer is a 3-week?
3 weeks, 21 days, right? Yes.
So 3 weeks from now, Lisa will get her second shot. But after 4 weeks, a total of 4 weeks, enough people will have their first shot that can then move to the next community down the way.
That's right. That's what our expectation is.
The first shot.
That's right. That's right.
How many,
Yes.
how many will be vaccinated in this first day, in this first week? And how many doses do you have on site right now?
We're expecting 7,000 doses this week, and I believe today, where is Regina? I think is it 180 today? We're expecting 170 today in the first day. Yes. Yeah, we're working with the state right now in the planning, so I don't have any specifics to reveal today. But yes, it will be in a large public area, something that's very accessible to the residents of New Jersey, something that they can access very easily, get in and out of. So we're in the process of planning. We'll hopefully we'll be able to make an announcement in the coming weeks. Again, I don't want to get ahead of our planning, but New Jersey has a lot of iconic sites like that are being considered. Yes.
What's the process for determining which of your physicians will go first?
Well, let me turn that over to Dan to discuss that. That's a great question. Thank you.
So as we looked at putting together the cohorts of people who would get vaccinated, the first thing that we realized is that, as Bob said, the difference between the very first people and the last of the patient-facing team members is a couple weeks. So we're not talking about a really big difference, and so we're confident that we're going to get our team members vaccinated and folks are going to be safe. We really looked at this predominantly, first of all, taking the 36,000 HMH team members and dividing them into people who were patient-facing and people who were not. And then within the patient-facing cohorts, we actually look at their risk of exposure to COVID. So those folks who are taking care of patients in COVID units, our doctors in the emergency department, our nurses and doctors in L&D, which are kind of the high exposure areas. And so we start with them, but we're going to have enough vaccine to cascade through that whole workforce in about 2 or 3 weeks.
Is everybody willing to take this shot?
Yeah, so I'll give you a little data on our surveying. We initially, folks, I think, were somewhat concerned that healthcare workers themselves may not really be very receptive to this. But we actually surveyed our internal audience here, got almost 7,000 responses from that. And we have 2/3 of our team members have said they are highly likely to take the vaccine right now. A very, very small number of folks inside Hackensack Meridian who have said that they're not going to take the vaccine. And then we've got probably about 25% of the team members who are saying, I'll let these guys do it, see how they do, and then I'll make my decision off of that. But I think we anticipate that, I'll bet you right now, we get very close to 80% or better of our team members getting vaccinated.
What does, and I don't know if this is a question for Valerie, but what does a public information campaign look like once this is available to the public? How do you get the word out that your clinical staff has already done this, and that we need to hit the 70% statewide?
So we're gonna be recording public service announcements, which will be out there, and we'll be talking and putting out information about the safety, the efficacy of the vaccine. We're going to be showing photos and video of our team members and our physicians getting vaccinated, showing, setting the example. So I think there's going to be a lot out there. There's a lot of media attention, obviously, right now, and we're going to try to get that word out there that it is safe and effective. And we're going to team up with the Department of Health on the communications plan as well. Commissioner Judy Persicelli, our Commissioner of Health, as I mentioned before, has set a goal of 70%. Vaccinated in 6 months. And, she's looking for partners to do that. She's looking for hospitals, health systems, medical providers to be in the lead. She even said to me, she said, Bob, she said, if the public will see doctors and nurses and other frontline caregivers, if they actually see them, getting the shot and getting vaccinated, it's going to go a long way to meet that 70% goal. So we got a multifaceted public awareness campaign that will happen, and people like Harry Carson and other celebrities, other public figures will be a part of it as well. So it'll be multifaceted, and we hope we'll get that. We'll reach that goal that the commissioner and the governor have set. I just saw some data to add to what Dan said, and I think throughout New Jersey now, in a survey of physicians, almost 85% said that they are willing to be vaccinated, or they're highly likely to be vaccinated. That's great. That's up from about 50% just about a month or 6 weeks ago. So the word is getting out there, and I think we're going to be very successful. Anybody else? Okay. Thank you all for coming and being with us on this very historic day. Thanks, everyone.